So good evening, everyone. So as we know that CDK4/6 inhibitors have been developed a significant improvement in overall survival and PFS in the patients of breast cancer who have metastatic disease and who are positive for hormone receptor and negative for HER2. We have different drugs available today, and we have sufficient data that support that there is significant improvement in survival with these drugs. Today we will discuss about pooled exploratory analysis of the data of Mona Lisa trials. 3 trials were be included. Next slide, please. Next. So in next 5 to 10 minutes, we will discuss about different 3 trials, Mona Lisa 2, Mona Lisa 3, and Mona Lisa 7. We will particularly focus on the patients having metastatic disease, having liver mets, having visceral mets, and having high disease burden. Next slide. So these are the trial design of different 3 trials. Mona Lisa 2 ribociclib plus letrozole was compared with letrozole alone, and in Mona Lisa 3 ribociclib plus fulvestrant was compared with fulvestrant alone. In Mona Lisa 7, patient population was slightly different. They have included premenopausal patients, and they were randomized to receive ribociclib plus hormone suppression with goserelin and with versus tamoxifen plus goserelin or AI alone. Next slide. So in this exploratory analysis, median PFS and median OS were evaluated using Kaplan-Meier method in a pooled data set of patients with visceral mets, with liver mets, and visceral mets with 3 or more metastatic sites. And for this analysis, first-line patients were analyzed separately. Next slide. So these are the baseline characteristics of the patients. We can see that both the arms were well balanced in terms of age, performance status, number of metastatic disease, site of visceral mets, and the treatment they received in first line setting. Next. So this graph shows PFS and overall survival in the all patient population having visceral metastasis. Here we can see the progression-free survival curve. The curves were well separated from the beginning, and there was significant improvement in PFS with hazard ratio of 0.61. The median PFS was 22 months versus 12 months in the endocrine therapy alone arm. And there was 39% reduction in the risk of progression in the patients who received ribociclib in combination with endocrine therapy. And this curve shows overall survival. There was significant improvement in overall survival also. It was 49 versus 46 with hazard ratio of 0.81. So this was about all patients having visceral mets. Next slide. This subset was the patients who received this therapy in first line. So patients who received therapy in first line, there was significant improvement in PFS, and the PFS was 29 versus 14 months with a hazard ratio of 0.56. Means there was 44% reduction in the risk of progression, and there was survival benefit also. The overall survival was 63 versus 51 months in endocrine therapy alone now. Next slide. So this graph shows the patients who were having liver metastasis. The patients who had liver metastasis, they were also benefited, and there was significant difference in PFS and overall survival in this patient population also. Next. Now, if we see the patients who were having liver metastasis and who received this drug in first line setting, the previous slide was about all patient population, but this was about the patient who were having liver mets and who received the combination in first line setting. So there was significant improvement in PFS, 16.7 months versus 9.8 months with hazard ratio of 0.55. And for PFS, the hazard ratio was 0.77. Next slide. These graphs are for patients who were having 3 or more metastatic site, and the PFS and OS both were improved among the patients who have, and the population of these patients were around 31%. And they were also benefited with combination. Next. This shows DFS and PFS and overall survival in patients of 3 or more metastatic site, and the drug was used in first line setting. So in this population, the PFS was 24 versus 14 months, and OS was also improved. Next. So next point is regarding the toxicity of drug. When pooled analysis was done, the authors found that the toxicity profile was similar among the different patient populations, and it was consistent with the previous trials where the data was analyzed separately. There was no difference in terms of neutropenia, nausea, vomiting, and all subsets of patients having liver mets, patients having visceral metastasis, patients having high disease burden, there was no significant difference in the toxicity in these patients. Next. So with this pooled analysis, we can say that the visceral mets has had a 44% reduction in the risk of disease progression and 22% reduction in risk of death. The patients who have liver mets, there was 45% reduction in the risk of disease progression and 23% reduction in risk of death. Patients who have visceral mets with high disease burden, there was 41% reduction in risk of disease progression and 20% reduction in the risk of death. So this trend of this shows that ribociclib benefited all the subset of patients, and the toxicity profile was not different from the individual trials. So we can conclude that the patients with visceral mets or liver mets, they experience a clinically meaningful survival benefit and OS benefit with the combination of ribociclib plus endocrine therapy, and it is an effective therapeutic option in these patient population. With this, thank you everyone for sparing time for this activity. Thank you, sir.
Thank you so much, sir.
So with the permission, can I announce one thing? As we have made the prize announcement also, so through this message, I will be requesting everyone, whether it's a delegate, faculty, or the participant, that they make some thoughtful questions or some other things in the chat box, so that can be judged for the prize winning category. So anyone can participate in that. Thank you.
Yes, sir.